There is a quiet tragedy unfolding in hospital wards across this country every single day that almost nobody is talking about, and it has nothing to do with cholesterol, nothing to do with smoking, and nothing to do with the genes you inherited from your parents. It has to do with 5 legal, trusted, everyday medications that millions of older adults swallow like candy, believing they are safe, when in reality each one is capable of chipping away at the heart muscle until the day it finally fails. And before this video ends, I'm going to name all 5, rank them from least to most dangerous, and show you the exact safer alternatives your doctor may never bring up. I've spent over 20 years as a cardiac surgeon, and I can tell you with my hand on my heart that the patients who haunt me the most are not the ones who walked in with obvious risk factors. They're the ones who did everything right, ate their vegetables, walked their mile a day, never smoked, and still ended up on my operating table because a drug they trusted betrayed them. My name is Doctor, and I'm going to say something today that my colleagues in the pharmaceutical world will not appreciate, but somebody has to say it, because if I stay quiet one more week, another Michael, another Helen, another Frank is going to end up exactly where I don't want them to be. Here's what I'd like you to do before we begin. Pause this video for 10 seconds, walk to your medicine cabinet, and bring back every bottle you take on any regular basis, prescription, or over the counter. Then, in the comments below, type the name of each one and add the word heart next to any drug you've been taking for more than a year. I personally read the comments on every video, and I want to respond to yours if I recognize a red flag. Let's begin the countdown, and don't let the numbering deceive you, because the last one on this list is something so common, so ordinary, and so seemingly helpful that you may never look at a grocery store shelf the same way again. Coming in at number 5 are the non-steroidal anti-inflammatory drugs, the family that includes ibuprofen, Advil, Motrin, naproxen, Aleve, diclofenac, meloxicam, and celecoxib. And I want you to understand the biology of what these drugs do, because once you see it, you can't unsee it. Every time you swallow an NSAID, 3 things happen almost instantly inside your body. Your kidneys hold onto sodium and water like a sponge that never gets wrung out, which forces your heart to pump against an ever-rising volume of fluid. Imagine a vacuum cleaner being asked to suck up water instead of air day after day until the motor burns out, your arteries tighten, and your blood pressure creeps up by 5 to 10 points, often without you feeling a thing. And most cruelly, if you're one of the millions of seniors on a baby aspirin to prevent a heart attack, ibuprofen physically blocks the aspirin from doing its job, leaving your platelets as sticky as they were the day you were diagnosed. The FDA slapped a mandatory warning on these labels back in 2005, but how many people actually read the fine print on a bottle of Advil? A gentleman named Michael, 72 years old, came into my clinic breathless last spring. He'd been taking 600 milligrams of ibuprofen 3 times a day for 2 years to keep gardening despite his arthritic knees. By the time I examined him, his ankles looked like water balloons, his lungs were filling with fluid, and an echocardiogram showed an ejection fraction of 35%, a heart that had been quietly drowning for months. The alternatives are not complicated. Topical diclofenac gel rubbed into a sore joint delivers real relief without reaching the heart, because almost none of it enters your bloodstream. Acetaminophen taken correctly, never more than 3,000 milligrams per day in a senior, is often enough. Physical therapy builds muscle that protects the joint better than any pill, and if you absolutely must take an oral NSAID, stay under 2 weeks and at the smallest dose you can tolerate. Sliding in at number 4 is a class of medication that has been prescribed so casually for so long that most people think it's as benign as a multivitamin. Proton pump inhibitors, commonly sold as Prilosec, Nexium, Protonix, Prevacid, and Nexium 24HR. Now here is the cardiac angle that most gastroenterologists simply don't emphasize. PPIs strip magnesium out of your body slowly and silently, and magnesium is the mineral your heart's electrical pacemaker depends on to keep a steady rhythm. Run low on magnesium, and atrial fibrillation, palpitations, and sudden skipped beats start knocking at your door. Secondly, PPIs reduce the enzyme that creates nitric oxide in your blood vessels, and nitric oxide is what keeps your arteries soft, flexible, and open. Shut it down long enough, and your vessels begin to behave like rigid copper pipes instead of healthy rubber tubing. Thirdly, if you've ever had a stent or a coronary procedure and take clopidogrel, Plavix, Omeprazole and esomeprazole directly interfere with how your liver activates that clot-preventing drug, potentially leaving you wide open to the very event the stent was supposed to prevent. Helen, 68, a retired librarian who had been taking Prilosec every morning for nearly a decade for mild reflux, came to me last year after she collapsed in her kitchen. Her magnesium level was at the bottom of the lab's reporting range. Her heart was in atrial fibrillation, and her cardiologist's initial thought was that she was simply getting older. 3 months after we carefully tapered her off the PPI and replaced her magnesium, she was back to gardening with her granddaughter. The smarter path involves working with your doctor to step down to an H2 blocker like famotidine, Pepcid, which is gentler on both magnesium and nitric oxide, raising the head of your bed by 6 inches on risers, not extra pillows which kink your stomach, finishing dinner at least 3 hours before lying down, and critically checking your magnesium level once a year if you must stay on a PPI long term. Number 3 is a surprise to most people because it sits on pharmacy shelves without a prescription and is marketed to anyone with a stuffy nose. Oral decongestants, specifically pseudoephedrine, Sudafed, and phenylephrine, which are also hidden inside dozens of combination cold and flu products like Dayquil, Mucinex D, Tylenol Cold and Flu, and Claritin D. These molecules don't just shrink the swollen tissues in your nose, they travel throughout your entire circulatory system, constricting arteries in your coronary vessels, your brain, and your limbs, while simultaneously stimulating your heart to beat faster and harder. It's like putting your foot on the gas pedal while also narrowing the highway. European drug safety agencies are currently reviewing pseudoephedrine's link to a rare but devastating condition called posterior reversible encephalopathy syndrome and ischemic stroke, particularly in older adults with pre-existing vascular disease. Margaret, 75, lost her husband the previous year and came down with a nasty January cold. She took a single nighttime dose of a combination cold remedy containing 60 milligrams of pseudoephedrine and within 90 minutes was in her bathroom clutching the sink, her pulse at 148, her systolic blood pressure at 218, a throbbing headache behind her eyes. Paramedics found her on the bathroom floor, and she spent 4 days in cardiac observation. The safer route during a cold is so simple it's almost insulting that decongestants remain on shelves, a humidifier running in your bedroom at night, saline nasal rinses twice daily, steam from a hot shower, fluticasone, Flonase, or mometasone nasal sprays that act only locally, and zinc lozenges that shorten cold duration by about a day and a half. Before I name the final two, and especially before I reveal number 1, which you will almost certainly find in your own home or your mother's home tonight, I need you to do me one favor, tap that subscribe button and hit the notification bell, because next week I'm releasing a video on the 3 over-the-counter supplements seniors take for heart health that are actually doing absolutely nothing, and one that's genuinely dangerous. You will not want to miss it. At number 2, we have the tricyclic antidepressants, the old guard of psychiatric medicine that includes amitriptyline, Elavil, nortriptyline, Pamelor, imipramine, tofranil, desipramine, and doxepin, drugs so frequently handed out today, not for depression, but for diabetic nerve pain, fibromyalgia, migraine prevention, irritable bowel syndrome, and stubborn insomnia. To an aging heart, this class of medication is a 3-barrel shotgun. Barrel 1 is orthostatic hypotension, meaning when you stand up from a chair, your blood pressure falls like a rock, your vision tunnels, and your legs buckle. And in seniors, a single fall with a fractured hip carries a 1-year mortality rate approaching 25%. Barrel 2 is a resting heart rate that climbs 10 or 15 beats per minute, which over months and years is equivalent to running a marathon your heart never signed up for. Barrel 3, and the most lethal, is QT interval prolongation. These drugs disrupt the potassium channels responsible for electrical recovery between heartbeats, and when that window stretches too long, a deadly rhythm called torsades de pointes can erupt without warning and kill a person in minutes. Frank was 78, gentle, thoughtful, a retired engineer whose diabetic foot pain kept him awake. His primary care doctor started him on 50 milligrams of amitriptyline nightly. Within 10 weeks, Frank stood up from his recliner to answer the doorbell. The room tilted, he crashed onto the tile floor, and the hip fracture he suffered began a 6-month downward spiral through hospitalization, pneumonia, and finally heart failure. There were so many other tools in the cabinet that nobody used. Duloxetine Cymbalta for neuropathic pain with far less cardiac burden, gabapentin or pregabalin for nerve-specific discomfort, topical capsaicin or lidocaine patches for focal pain, sertraline, Zoloft, or escitalopram, Lexapro, when mood is genuinely involved, and low-dose melatonin or cognitive behavioral therapy for insomnia, none of which carry the electrical chaos that tricyclics bring. And finally, at number 1, we arrive at the medication I genuinely believe does more silent cardiovascular damage to American seniors, especially women over 65, than any other on this list. And here's why it lands at the top. It's not even classified as a drug in most people's minds. It's sold in the vitamin aisle without a prescription. It's recommended by well-meaning doctors. It's promoted on television by women in white coats. And it's been taken religiously by tens of millions of seniors for decades in the name of protecting their bones. I'm talking about high-dose calcium supplements, typically 1,000 to 1,500 milligram pills of calcium carbonate or calcium citrate. Here is the biology your cardiologist rarely has time to explain. When you eat calcium in food, dairy, leafy greens, sardines, almonds, it is absorbed slowly over several hours, buffered by the rest of your meal, and efficiently deposited into your bones where it belongs. But when you swallow a 1-200 milliliter calcium tablet on its own, your blood calcium level spikes sharply within 60 to 90 minutes, and your body has no safe place to store that sudden surge. So the excess calcium begins depositing into the walls of your coronary arteries, your aorta, and your heart valves, a process cardiologists measure directly on a coronary artery calcium scan. This calcification hardens your vessels, narrows the channels blood must flow through, and becomes the scaffolding that cholesterol plaques attach themselves to, which is why landmark analyses published in the British Medical Journal suggested a meaningful increase in heart attack risk among women taking high-dose calcium supplements without vitamin D. And even the studies that dispute the finding agree on one thing. Supplemental calcium does very little for bone fracture prevention in community-dwelling seniors. Linda, 70, came to me after a heart attack that shocked her entire family. She had no high cholesterol, no diabetes, no smoking history, no family history, but she had been taking 1,500 milliliters of calcium every morning for 15 years to prevent osteoporosis, and her coronary calcium score was off the chart. The right approach is almost embarrassingly simple. Get your calcium from food. A cup of plain Greek yogurt has 230 mg. A cup of cooked collard greens has 270 mg. 3 ounces of canned sardines have 325 mg. A cup of fortified almond milk has 450 mg. Get your vitamin D3 level checked and aim for 40 to 60 mg, because without D3, you cannot absorb dietary calcium properly. Add 100 to 200 micrograms of vitamin K2, MK7, daily, because K2 is the traffic cop that directs calcium into your bones and away from your arteries. Do weight-bearing exercise 3 times a week because bones respond to mechanical stress, not just minerals, and only consider a calcium supplement if your doctor has documented a genuine deficiency. And even then, keep it under 500 milliliters per dose taken with food. Now listen to me carefully before we close. Nothing I have said today is a reason to panic, and nothing I have said is a reason to walk into your bathroom and flush your pills down the toilet. Doing that can be just as dangerous as the drugs themselves, because abruptly stopping a PPI causes rebound acid, abruptly stopping a tricyclic causes withdrawal, and abruptly stopping any cardiac-relevant medication can trigger the very event you're trying to avoid. What I am asking you to do is become an informed partner in your own care. Print out the list of the 5 drugs I just named, put a check mark next to the ones you take, bring that paper to your next doctor's appointment, and ask 4 specific questions in this exact order. Is this medication still necessary for me at my current age? Are there safer alternatives I haven't tried? Is the dose appropriate for someone my size and kidney function? And how will we monitor for cardiac side effects going forward? Those 4 questions, asked politely but firmly, will change the direction of your care more than any supplement, any diet, or any exercise program ever could. If this video taught you even one thing you didn't know an hour ago, please do 3 quick things for me. Leave a comment below telling me which of these 5 medications surprised you the most. Share this video with one person over 60 that you love. your spouse, your parent, your sibling, your dearest friend, because a 2-minute conversation sparked by this video could literally be the difference between them celebrating their 80th birthday at home or spending it in a cardiac unit. And subscribe to the channel so the next warning I put out reaches you first. Remember, your heart cannot speak for itself, so you must learn to speak for it. The most dangerous drug in your cabinet is the one you never questioned, and the safest patient in the hospital is the one who walks in already knowing the right questions to ask.